The videos that we have of motion x-rays is a new type of x-ray, and the difference is the old-fashioned static standard x-ray is take a deep breath and hold still. Well, most patients don't hurt when they're sitting still. They hurt when they do things. So now we have what's called a motion x-ray. Motion x-ray is like a video. It's like as if we had a camcorder, but we're looking inside. So we're looking at an x-ray, but we're looking at an x-ray when you're moving and doing things. So we have you do all the things that hurt, and we're looking inside and we see what's happening to your spine on an x-ray when you're doing something that hurts you. So you're actually moving, you're turning, you're twisting, you're bending, and we're looking inside at the spine to see what's happening when you hurt. And it helps us to detect what your injuries are, and therefore it helps us to treat you. A motion x-ray is an x-ray that shows the injuries as they occur with movement, and they're showing injuries to what are called ligaments. And ligaments' job, they go from bone to bone, is to hold the bones in proper alignment, keep them perfectly lined up. If they're not lined up, they're going to end up hitting bone on bone and causing pain, or the bones will actually pinch on nerves. So you have a ligament here called the posterior longitudinal ligament. Its job, when you move forward, is to keep the vertebra lined up. So here's these lines, we can connect them. It's right where the ligament goes. They're perfectly lined up. And then we're going to see what happens when somebody gets involved in an accident and these ligaments tear. So here's the accident up here. This ligament tears. And the reason for the tear is ligaments don't do fast movement. They do slow movement really well, but when it's something sudden, like an accident, they tear. Once it's torn, it can't do its job. So now when this person bends forward, here's an x-ray, this is the actual motion x-ray. If we draw a line in the back of this one and the back of this vertebra, they don't line up anymore, they don't connect. And that means that that ligament right there that should hold it has been torn. Can't see the ligament, but you can see the result of it being torn. The vertebra has slipped forward, bone is hitting bone, and then the nerve that comes out from here ends up getting pinched and irritated because of that excessive movement. It shouldn't move, it should have stayed lined up, but with the ligament torn, it allows that vertebra to move forward. In this motion x-ray, we're looking at two specific vertebrae, the top two. It's called C1 and C2, and the ligaments that hold them together and keep them lined up. And so we have these ligaments here, and then we're going to show a person with their mouth open in a motion x-ray, and these vertebrae are lined up side to side. In order to see those vertebrae, you have to have your mouth open, because otherwise your teeth would be in the way. So that's why this person has their mouth open. Here's that lined up. This is the ligament here. This is the ligament here. Vertebra lined up perfectly. We tilt to the side because the ligaments are fine. They still stay lined up just like they should. But when those ligaments get torn or damaged, you'll see movement where the vertebrae don't line up anymore. So now we're going to show when the accident happens, the ligaments actually tearing, like that. And then we're going to show the motion x-ray again, and the result of that tear is movement that was not occurring when the ligaments were intact and normal. So now when the person tilts to the side, we have to get them lined up so the teeth are out of the way, and we draw a line at the edge of this vertebra, and at the edge of this one, there's a big gap. Well, that means that that ligament has been torn, and it's allowing that vertebra to slip off to the side. So now you see that they're not lined up like they should be. And this causes specific symptoms, typically neck pain at the back of your head and severe headaches. When patients see this, sometimes they start crying because they, for the first time, are actually seeing their injuries and realizing, wow, I really am hurt, because they can see it.